And welcome back to Miller and Brinson's. We continue on rapid fires. Fun today.
I had a great time, man, as always. It's super when we
job.
participate. I'm getting better at the questions.
Yeah, you got a long way to go.
Okay, thanks.
All right, we've got Cardinal baseball coming up here at the top of the hour. The Cardinals on the road against Washington after being swept in Milwaukee. But it's time again to talk to our friend, Dr. Grant, from the Iowa Sleep Disorder Center. 2 locations, West Des Moines and Ankeny. Their website is iowasleep.com. Couldn't be much easier than that, iowasleep.com. And the doc's with us. Doc, good to see you.
Great to be back. Thanks for having me.
Well, appreciate you coming in. You know, it's funny. Jim and I both heard the storm last night, me more so than him. He's lucky. He can sleep through it. I can't.
I'm gone.
Yeah, you're very lucky.
I am.
You know, I take and I know I'm not alone. There's a lot of sleep aids out there, some over the counter, some prescribed. I don't know if it's just gets in our heads that we need this, and if we don't take it, we're in trouble because, we can't sleep. We forgot our sleep aid. How important are sleep aids in the sleeping industry? Do they work?
That's a great question. I often see patients that come in for insomnia evaluations, insomnia being the fancy pants term for not being able to sleep, whether it's difficulty falling asleep or difficulty staying asleep. And as a sleep specialist, I greatly appreciate the referrals from my primary care colleagues, but I also have a fair degree of caution in reflexively prescribing or recommending sleeping medicines, because sometimes our inability to sleep or our body waking up from sleep is actually helpful, especially in people that have troubles with ventilating themselves or breathing at night. Providing certain individuals with sleeping medicines, and in a general class we call these hypnotics, can at times suppress arousals from sleep that may assist in ventilation.
So important then that you do wake up. What your body's telling you is, the pill's there to try and keep you and to keep you under, if you will. But your body's telling you, hey, you need to get up.
Yeah,
or wake up.
Your brain will always choose breathing over sleep.
Yeah, thankfully.
Yes.
Yeah. But with that being said, there are certainly a fair portion of insomnia patients that don't have trouble breathing when they sleep. They're waking up either because of what we consider to be a psychophysiologic or conditioned insomnia, some degree of anxiety. There's also a high comorbidity of people with depression that have difficulties with insomnia as well. It's a very heavily pushed, marketed segment of medications. I think if you just pay attention to primetime television, you see how heavily sleeping medicines are advertised.
And are there some that perhaps weren't invented or created to be a sleep aid that have now crossed over into that genre?
You bring up a great point. A lot of the medications that you see that have the PM preparation, whether it's Advil or Tylenol, are nothing more than those pain medicines with associated diphenhydramine or Benadryl. That's the other name for Benadryl. And these are antihistamines that are theoretically anti-allergy medicines, but when people take them, they make you sleepy. But it should be noted that they are not FDA-approved indications for this. In other words, you're taking the medicine not for its primary effect, but for its side effect.
If you're in a situation and you struggle to sleep at night, and it's because of your nose is clogged, you can't sleep on your back, you have to sleep on your side or on your stomach, how can you help somebody who has those issues?
Well, I would say that a thorough evaluation at the Sleep Disorder Center is a starting point. I'd be surprised. I'm usually surprised by the number of people that have struggled with these issues for years and only crossed maybe a threshold of falling asleep on the job and the fear of losing a job, or driving drowsy, or some other kind of sentinel event, maybe the spouse or bed partner saying, you need to get checked out, that brings them into my office. When it comes down to problems with breathing or ventilating at night, there are a number of evaluations that we do. This time of year, people can suffer from allergic rhinitis. The pollen counts get up. There are some nasal corticosteroids we can use. There are some regular anti-allergy medicines that are real helpful. Those are more transitory phenomenon. People will even say, it's this time of year that I really have difficulty. but also pattern recognition. I'm not doing a great job answering your question, but some of it can be subtle, and you really need to sit down and talk to a patient and get their history. About 90% of a diagnosis, in my opinion, is made off of a good history.
Interesting, and that's kind of where I want to go when we wrap up with you. How long does when you see somebody for the first time, and I'm guessing that it varies from patient to patient, but if somebody wants to, that they're struggling, they know that sooner or later they're going to have to pick up the phone or go online and get a hold of you guys at Iowa Sleep Disorder Center, iowasleep.com, and see how long is that initial consultation, that initial meeting with a patient, Doc?
I budget 45 minutes to an hour.
Do you really? Wow.
Yeah. I think people can be very complex, especially people with a dense past medical history, because I believe that there are a lot of interfaces or touch points between other medical diagnoses and sleep. So you need to kind of get a global awareness for what the patient's past medical history is, what the current medications that they take, what their social functioning is, what their stress levels are like. There's a lot that goes into the diagnosis and management of a sleep disorder, far more than just breathing. And
to wrap things up, I know you mentioned this all the time, but for those of you hearing Dr. Grant from the Iowa Sleep Disorder Center for the first time, in most cases, your insurance is going to cover this procedure.
Absolutely. Absolutely.
I think everybody is, concerned about that. I think that's one thing that you really have to emphasize, that it is covered by insurance.
Without a doubt. Dr. Grant, good to see you, and thanks for answering our questions as always.
Thanks for having me back.
All right, Cardinal baseball is coming up next. The Cardinals slept through the weekend. Hopefully their bats have woken up as they get set to take on the Washington Nationals here tonight. That's coming up next on Des Moines Sports Station 1460 KXNO.